This video is designed to help patients in Saskatchewan learn about the important things they need to know before and after a total joint replacement. The video lessons and steps outlined by the Saskatchewan Hip and Knee Pathway are designed to help patients through the process of the surgery and onto a healthy recovery. In this module, you will get an overview of total hip replacement surgery.
The ideal candidate, whether it be hip surgery or knee surgery for joint replacement, is the patient who has really exhausted other measures of therapy. It might be anti-inflammatory medications, it might be physiotherapy, it might be injection therapy, it might be braces or walking aids, it might be weight reduction, it might be patient education. They've been through the full gamut. They have no further recourse other than to look at a joint replacement.
The time when it's right for them to have a hip replacement is when their pain and their functional problems make the risks of an operation and the period of time of recovery worthwhile. And I don't think you'll find any surgeon that ever tells a patient with arthritis, you have to have a hip replacement. It's really the patient's choice. And when their problems are enough that it warrants the small risks of an operation, then that's the time to think about a hip replacement.
Osteoarthritis attacks the cartilage that lines the inside of the joint and the ball. What happens is the cartilage thins, starts to flake off, and eventually you'll end up being bone on bone and then require a hip replacement. With a hip replacement, the most standard hip replacement involves resection of this part of the femur right here through the femoral neck so that we're left with the shaft. We take the ball off. With the ball off, we then drill this part of the bone, which is called the acetabulum, and then we have reamers, which are used sequentially to increase the size of the acetabulum until we have good bleeding bone. Then a cup, which is made of metal, will be placed inside there to replace the articular surface. Once the cup's in, then we place a plastic liner in the cup. Once this is done, we then turn our attention to the femur. With the femoral component, we've cut this ball off, and then we place metal stems down here of sequential different sizes till we get to the size we want. And then the metal stem has a ball attached to it that we can be able to reduce that ball with the shaft into the acetabulum and allow pain-free range of motion. And then after that, it's just a question of physiotherapy for recovery. Standard recovery time is between 3 to 4 months.